Hello dear viewers, and we're back again. So from the world of fabric and silk and into dental, in a world where a simple dental visit can turn into a moment of fear for many children, especially those with special needs. The role of commissionate and highly skilled specialists becomes truly essential. Pediatric dentistry today goes for beyond treating teeth and about building trust, easing anxiety, and creating a safe space for young patients. Now, joining us this morning is a distinguished expert who has dedicated his career to transforming children's dental experiences and addressing the unique challenges faced by families. We are honored to welcome Dr. Jarrah Alkandari, specialist, a pediatric and special needs dentist, to shed light on the impact of stress and fear on oral health and to share practical insights every parent should know. And welcome to the show, Dr. Jarrah, and how are you?
I'm good. Thank you for having me. I'm quite happy to be here today.
It's such a long introduction, but a long CV, but it is a very important, especially for kids that are basically special needs. So yes. Let us get into that world. What is it exactly that you do and how is it so unique?
Basically, as a senior specialist in pediatric dentistry, my job is not only to treat the teeth problems that children have, not only the dental problems that they have, but we manage the entire oral health, which also has to deal with patients' emotions, their behaviors, their different backgrounds. We have to manage the child as a whole. We have to tailor our treatments and our treatment plans and our management techniques depending on the child, depending on their behavioral issues or on their sensory requirements. We also depend on the child's stress and anxiety levels as well.
Yeah. Now, you know that basically visiting the dentist is always kind of a scary thing, and children are always anxious. So how can fear actually be a negative reaction to kids who are visiting the dentist and also for their oral health?
Definitely, that's a good point. Fear leads to avoidance. Avoidance being when the child needs dental treatment, they will not have that dental treatment. This starts a vicious cycle. It comes into a complete circle. You have the fear, the child has fear of coming to the appointment or anxiety of coming into the appointment. They then have a dental problem, which usually starts out as a simple problem, which goes untreated because of their fear. The problem becomes bigger. The fear then becomes even higher because the more difficult the problem becomes, the more invasive the treatment becomes, and the more anxiety it will inflict upon the child.
Yeah.
When the child comes in for their initial visit, when the initial visit itself is a short visit, which is basically an examination, discussing things with the child, talking with the child, explaining what dentistry is, having the dental checkup, maybe taking an x-ray and going home, is much easier and less invasive than a child coming in to have a tooth removed or to have a root canal or a crown, which can be a very devastating first visit, especially when the child is quite young.
Yeah, that's very true. I mean, if you think about it, when a child doesn't go up for his regular checkups, it becomes a problem. Definitely. It becomes something that is even chronic at one point.
Yes.
So rather than him having a fear of going to the dentist, then now he has a fear of pain, which which it shifts from one thing to another.
The child will associate going to the dentist with pain. So whenever the parent says to the child that, okay, today we're going to be going to the dentist to have a checkup, his immediate association will be, oh, I'm going to the dentist to get a shot, to get a tooth out, to have a crown, and this is going to be painful. I don't want to go. That's it. So this is what happens.
So parents often struggle to prepare their children for dental visits. Practical steps can they actually take? What practical steps they can take to actually reduce this kind of anxiousness that the child has?
First step is using child-friendly language. Avoid using the word needle.
Okay.
Avoid using the word pain. Avoid using the word restraint, or we're going to hold him, or whatever that is in front of the child, because these words will trigger fear and anxiety, and the child will not be willing to have any procedure or treatment done at the time. Also, modeling a visit at home is also a good choice. We sometimes recommend parents to explain simply what's going to happen at home by modeling with the child. Get the child to lay down on the sofa, the parent gets a tiny mirror, looks inside the mouth. So the dentist is going to go look inside your mouth, the dentist is going to spray some water inside, the dentist is going to spray some air. These kinds of things help alleviate the anxiety. Also, using child-friendly videos. You can find them on YouTube, but make sure they're child-friendly, make sure that they are not having any invasive procedures or anything. Also, there are very nice children's books about the dentist that they can use. So parents use those all the time, and they do help a lot.
I mean, even there are specific toys that are actually made for dentistry, where they show just the oral section and you can, how you pull out the teeth. I mean, I'm doing that with my kids now. They're having fun plucking the teeth. It's fun
with the Play-Doh and all these things.
Exactly. Yes.
Yeah. This helps a lot actually. Also, you wanna make sure that you schedule your appointments at a time where the child is well rested. If the child, for example, always has an afternoon nap, and you schedule the appointment at the time of that afternoon nap, the child will not be happy because they're used to having rest at the time.
Yeah, they'll be cranky.
Make sure that your appointments are at a time that is suitable for the child as well, not just for you.
Yeah, and just make sure that they also don't get in when they're sick, like have a fever or any nasal problems too.
Exactly. So these are the kinds of things that the parents can do. Also, a very important thing is that make sure that you are going to a pediatric dentist who is qualified and has the experience to do the treatment. Dentistry is split into many branches. So you have to make sure that the dentist you're going to is qualified and has the expertise to manage children and has the basically the skills and the tools available that can help them decrease any anxiety to the child and make sure that the child has a good experience as well.
And also at the same time, it's not wrong for parents to sit down with the doctor and talk with them and ask them about the procedure, and also ask about their credentials, about their certification, about their experiences.
Definitely, and we highly recommend that. Even when a parent comes to me, for example, and asks me, well, what are your qualifications? How many years have you been doing this? I feel alleviated because I know that I'm dealing with a person in front of me who knows what they want and knows that the things that we do depend highly on the training we have, the qualifications we have, the experience we have. And that makes my job easier as well. Yeah,
and it makes you an honest person, because this is what, I mean, in general, what medical is all about, is to be honest and be transparent. All right, now, you work closely with children with special needs. How do you adapt your approach to ensure they feel safe and comfortable during a treatment?
Yes, so with children with special needs, we have so many factors that go into making the visit a good, safe, and a good outcome as well from that visit. The main problem we have with children with special needs are either sensory or behavioral issues, positioning issues. We also have problems with children who have who are medically compromised and have different medications that they have. They are being treated by multiple doctors for different systemic problems that they may have as well. So we have to kind of tailor our treatment and our behavior management techniques towards a specific child and a person. Pediatric and special needs dentistry is something I always say, it is not a one-size-fits-all.
Very true.
You have to specifically tailor your treatment plan. You have to make sure that you are providing the person in front of you with the treatment that is suitable for them. It is not a one-size-fits-all. So let's say, for example, if I have a child with autism, who is on the autism spectrum disorder, the child may have a mild form, they might have a moderate form, they may have a severe form. They could be verbal, they could be nonverbal, they could have severe behavior management issues. So, not all autism patients are treated the same. Now, saying that, a child with autism, the problem at the clinic becomes more of a sensory and a communication problem. So, the problem is not the treatment itself, the problem is the sounds that go along with it, the environment itself, the feelings that they may feel inside their mouth. So we have to understand from the parent and from the child what are the things that trigger anxiety in their child, and we have to work around them. Sometimes we'll be able to kind of use our regular behavior management techniques, which are tell, show, do. We tell the child what we're going to do, we show the child, and then we do the procedure itself. Modeling may sometimes work. Using media, for example, using stories which explain the steps. Making sure that the child, especially the child with autism, knows what's going to happen. Use clear language. Don't, for example, say something and then do another. For these children, you have to be quite direct and simple in explaining the procedure, because they will take what you say literally. Okay? Now, other cases, we will not be able to communicate efficiently with a child. In these scenarios, we may have to go to something called pharmacological behavior management, where we deal with the behavior through medication. Sedatives, for example, nitrous oxide gas, for example, which is basically laughing gas. Sometimes when behavior issues are too severe, or let's say the treatment itself is too invasive, they have too many teeth that need to be done, the procedures will be, I don't want to say the word painful, but be uncomfortable for the child. We then may reform to doing the treatment under general anesthesia, which is basically a hospital-based treatment. General anesthesia. And
that's for the safety of the patient.
It is for the
that's
safety
the
of the
point
patient.
of it.
And it is very useful, and we do use it a lot of the time. Parents sometimes are anxious to have their child go under general anesthesia, but I always explain to them, when the child is uncooperative, the child is kicking and screaming in the chair, you have to do a very delicate and sensitive procedure. You have to do it quickly, and you don't want to hurt the child. You don't want to psychologically graze the child. You don't want them to fear coming to the dentist again. And you want to do the procedure correctly, which is something the parents don't really put in mind. We have to have the child being still. We have to have the child calm.
Parents need to understand this is another form of treatment.
It is.
And it is a safe form.
It is a very safe form.
It is true that it is the last form, but it is still a form that is being used for the reasons why, so that the child doesn't get, emotionally scarred, or even physically scarred.
Exactly. And when you say it's the last form, I kind of disagree with that, because as I said in the beginning, pediatric dentistry is tailoring your treatment to the child.
Very true.
It is actually, a lot of the time, my first line of treatment. I know that this child needs to go general anesthesia. I will not even try to
out
do
of
the
experience.
Exactly. So this is where experience comes in. And your pediatric dentist knows how to deal with your child. So we always recommend that you do your due diligence, and you make sure that you're going to the correct person. And even if you feel, let's say for example, you come to me, I tell you your child needs general anesthesia. You say, well, I'm quite worried about that. I don't want to do general anesthesia. What I tell you is, all right, this is the treatment plan. These are the x-rays. Go to my colleague who's also a pediatric dentist and get another opinion. There's nothing wrong with that.
Very true.
Some dentists get quite tense when someone tells them, I want to get another opinion. No, you shouldn't, because what you're saying is right, and what you're saying is evidence-based, which is the most important word in medicine and all of healthcare at the moment. Our treatments are evidence-based. We don't just come up with them and say, well, it works for me and that's it. No, we look through studies, we look through systematic reviews, randomized controlled trials. All of these things are the things that shape how we approach treatment and how we treat our children.
All right. So are there any early warning signs that parents should watch for that, for that indicate that their children is experiencing dental anxiety?
Yes, definitely. If the child, let's say for example, you have an appointment tomorrow. You tell your son or your daughter, well, we have an appointment tomorrow, we're going to Dr. Jarrah. And the child starts saying, oh, I have a tummy ache, I can't go, my stomach is hurting me, I have a fever, I'm sick.
They're stalling.
They're stalling. These are signs that the child has dental anxiety. When the child starts to clench their teeth, bruxing at night, these are signs that they have anxiety. When they walk into the clinic, you see them hiding behind the parent, just kind of eyeing you from behind the parent's back. You know that they have anxiety. When the child, as soon as they sit in the chair, they tell you, I need the bathroom, I need a drink of water, you start to know. So these are the things we kind of, clues and hints that we pick up on. They're very minor. People don't really recognize them as parents, but we know when a child does that, they do have anxiety. And we have to kind of slowly ease into the visit. Sometimes when we feel as though the visit isn't going the way we like it to be, we kind of slow down the visit. Make the visit, for example, the first time as a consultation visit where we just examine the child, speak with the child, explain things a bit, take a couple of x-rays, and then the child can go home and come back on another day. This way the child will feel as though, oh, okay, wasn't too bad. I sat in the chair for a bit, spoke to the dentist a bit, I went home, everything was okay, so it's not too bad. And that kind of gives them something to fall back on and feel as though, well, okay,
things are kind of chill and relax.
Yes.
So with that, could you give us a quick final message for the parents, actually?
Yeah. So my final message is start early, be consistent, and focus on prevention. When you say start early, you want them to be, your children to be coming into the dentist at their first birthday, at a max. You want to stay consistent by coming in every 6 months for their regular checkups, making sure that any problems have been identified and managed. And prevention. Prevention is key. You want to make sure that the child is brushing their teeth at least twice a day, once in the morning, once at night before they go to bed. Make sure that we cut down on the sugary intakes, all the foods that are sticky, and even chips and crisps and all these types of foods and snacks that stick to the child's mouth will cause cavities. And let's just hope that everyone stays safe.
Yeah, let's hope
and healthy.
Yeah, thank you so much, Dr. Jarrah, and we hope to see you soon again. This was a beautiful, actually, conversation that I had with you, and I'm sure that the dear viewers actually had a lot of information that they've never known, and they just peeked at it for now, and it's nice that you're the one who sent out the message, and we hope to see you soon again.
Thank you for having me again.
Welcome.
Thank you.
All right, all thanks and appreciation to our guest, Dr. Jarrah Alkandari, specialized at pediatric and special needs dentist. And now with that, dear viewers, we're going to go for a quick report, and we'll be right back after this.